Forget about your basic stuff, your body mechanics. When you're in the clinic, your CIs notice those kinds of things because if you're like me, you have to be working for a long time, 30 years or whatever. So body mechanics, goniometer placement, go back to where your stationary arm goes, your moving arm, your axis, all that stuff. So the farther you get into the program, you're gonna start combining stuff you learned previously with what you're currently doing, right? So don't forget about that.
Juice. Alright, so performance we kind of already went over. It's just a comparison. There is no measurement. It's just that first part right before you did the performance test. Again, flexion, abduction, external rotation, and then you just bring it up. Okay, and you're feeling for that whole capsule of movement pattern. And then you compare left and right.
That to go to the whole range of motion. So just one straight.
So you're kind of just drawing a big circle with the knee.
Gotcha.
Okay. And if they're tight, you'll feel it, or they'll tell you, or you'll feel the pull back on it. That's your piriformis. Comparison, no measurement, just a comparison. Go ahead, actually on your side. This will be perfect. So overs. Or for your iliotibial band. Iliotibial band, it's just that overs test. Modified Sharon's actually really good because she's actually positive. So again, hip, knee, and shoulder need to be in one line. And as you go ahead and drop them. If it goes down, it goes down. Go ahead and compare it to the other side. Hip, knee, let go. There you go. Hip, knee, and shoulder in line. And again, go ahead and relax. And I'm going to slowly let you drop. Okay.
See how she's coming forward with that? Going into more flexion, right there, see that?
It's a slow, if it pulls this way. So that's also things that you're in comparison. But obviously you saw the left didn't even go down, so that could be your positive. So is, yes.
That was the IT band for muscle lengthening?
Yes, for muscle lengthening. It's just a comparison, no measurement. For psoas, we talked about it already. We are going off the edge in a Thomas test position. Thank you, ma'am. Knee approximately at 50 to 70 degrees of knee flexion. Wait, let me double check. No. Knee extension, knee flexion. Oh, we already did that. Hello. So his test was the measuring in. Hold on. Go ahead and lie on your stomach. So for just iliopsoas, maintaining knee flexion at about 50 to 70 degrees. Relax. You are actually pushing through the lumbar and lifting. And again, it's a comparison. So even though it would feel better here, you're just looking, and you're looking for the rotation and how high you can get off into extension. If you want, you can go ahead and have somebody measure at the hip extension to compare on both sides. So that's just iliopsoas in pro.
And you're looking for the rotation of the hip extension?
You're just seeing them, you're just pulling them into extension. Hip extension.
Ms. G,
Yes.
so you said the piriformis, the IT band, and the iliopsoas are comparisons, no measurement?
Yes. Okay. And that's just a subtle, so it's a comparison. I feel. And then iliopsoas and rectus femoris is our Thomas test, measuring at hip flexion and knee flexion. Go ahead and write now. Off the board. Perfect. Go ahead and hug this leg. And then you're measuring at hip. If it comes off the table, which it does, just a smidgen. But not too much, actually. No. That's good.
My knee like goes into extension, so what does that mean?
So then we'll more so to rectus femoris than I would psoas. So she's at like 5. And knee flexion, she's at 40. Go ahead and switch. Yeah. Okay. So here we got 70, and then this one's flat. Did you see what I just did? So slightly more tight on this side just because hip was at a 5-degree flexion, and then this was at 40 degrees of knee flexion versus this side was 70 and the hip was straight. So there is some tension on the rectus femoris as well as the psoas on top of the left side. Anthropometric measurements, so much fun. So that's psoas rectus, and now we just do QL. QL is also just another observation. Go ahead and stand for me. And it's a funky position. So QL does what, anyone? Lateral flexion and slight extension. Yes, please. So you're going to go into slight forward flexion and then contralateral. Stretch, reach over, kind of lean forward more. There you go. QL. So you're measuring. For me, personally, doesn't say this in your book, but you can go off the landmarks. No, actually you can't, because then you have, no, it's just skewed. Never mind. So just observe. So keeping them in the same position. Lateral flexion, opposite side, slight forward flexion. Okay.
You want the, when you say forward, do you mean spinal flexion or
Spinal
hip
flexion.
Oh.
Spinal flexion. And then again, compare it to the opposing side.
But no measurement.
No measurement. Because what I would have measured, but it's not right, would have been the border, the inferior angle to the PSIS, but if a person has winging of the shoulder blade, has a tilted of the shoulder blade, that's gonna be an off measurement. So in your book it says none. It's just a visual comparison. And then you ask your patient, go ahead and do it again. Which one feels tighter?
This side, my left
That
side.
side? Good, go that way. So this, compare it to opposite. Yeah, drop it down. Thank you. Good, yeah, and you can visually see too. Alright, so those are all just no measure, just observing. Okay, on your back. We're moving our way up. Wrist extensors, finger extensors, wrist flexors, and finger flexors. Are these active and passive insufficiency muscles?
Yep.
Yes.
Most of them are. Should you probably try to get this and knock it off your list? Yes, would be a smart idea. Knees can be bent, you can be in hook lying. The arm just needs to be at 90 degrees. So we'll do both. If I am putting them, if the wrist is extended and the fingers are also extended, is that passive or active insufficiency for flexors?
Passive.
Passive insufficiency for flexors, okay? And then you're measuring from the pinky side. So go ahead and hold that position. Stationary arm, just like how you guys were doing it before. I'm at 65. Okay. Now, if we're doing flexors, just have to rotate them. Here, fingers flexed, and wrist flexed. Good. And then you switch your position. Again, pinky side, and measure. And 72. Okay, and then compare. So here, passive insufficiency for my flexors. Good, and then palm down and wrist down for my extensors. Oops, sorry guys. Okay, so wrist extensors and flexors. Yes.
Would the extensors, they're flexing when it's dropped to the side.
When the extensors are flexing. I'm sorry?
Or when you're measuring muscle lengthening for wrist extensors and finger extensors, that's when they flex because it's in passive insufficiency.
Passive insufficiency. What takes it out is the elbow. Just make sure the elbow is in extension.
In extension.
Elbow is in extension and shoulder is at 90 degrees. Oops, for both. Okay. Triceps. So you can do this one sitting or supine. Patients are already supine. Gonna just have them do it. Scoot towards the edge, towards me. Hook lying position. Arm in complete flexion, elbow in complete flexion off the edge of the table. And for triceps, supinated, okay, on the wrist, on the forearm. And you are bending the elbow as much as you can. And obviously she don't have any tricep tension. If somebody, can you go where? Off the table? See, you can sit up. Come, Chaz. I don't know, just.
What's wrong with me?
There's lots of things around. Scoot towards me. So you might have imputing muscle length, and you just have to make a note of that too, for whatever reason for your knees. Right here and here. And you should have normal elbow flexion, which is what? 150. 127. Other side. Can you bend more than that? No. Do you feel any pressure in the shoulder? There we go. 129.
What? Big guns.
Okay, other side. Probably good for my last one too, because I see it already. Go scoot over towards me more. 134.
Nice.
Okay, so for the patient himself, he's got some differences. So that's your triceps, and then your biceps is going to be extension of the shoulder. Oh dear Jeezy. Shoulder extension, forearm pronation, and elbow flexion. So stay there. Shoulder extension, forearm, and then scoot all the way up to the edge though. So shoulder extension, forearm pronation, and elbow extension. And their norms should be, I believe, where is it? Dingle hoppers. Normal elbow extension. Okay. So if the patient themselves, it's not the shoulder you're looking at, it's the elbow. As long as that's straight. 4. Elbow extension.
Oh, it's like
Zero. Okay. So 4 on the left. So minus, what did you guys get taught? 4 degrees of elbow. Huh?
Elbow extensions should be just 0, right?
Elbow should be 0.
Yeah, just
How did you
zero.
guys get taught to write it? Because I write it differently.
What do you mean?
0 degrees.
If there's more, that's negative.
If it's
Yeah.
more, it's negative.
It's negative if it's more than 0.
Oh, yes.
Hyperextension.
So if it's hyperextension, it's negative.
It's negative.
So it's just 0. So it's 4 degrees of extension.
Yep.
Yep. There you go. Yep. There you go. Right?
4 degrees. Hyperextension gets you a negative.
4 degrees of extension. I'm saying it's 4 degrees of extension because 0 would be norm, so it's 4 degrees off. Yeah, it's just 4, right? That's what.
It's positive.
That's
Oh, it's a positive hyperextension?
Yeah, it's
Okay,
positive
so-
hyperextension,
okay.
then if they're like
So we'll
this,
just keep it that
that's
way. So we'll
negative.
just write it out as
Yeah.
4 degrees of elbow extension because that would make it 4 degrees till you know 0 would be your norm. Make sense? 4.
4 degrees because he has still a
Wouldn't
little
it
bit
be
of
4
flexion
degrees of
or
hyperextension?
hyperextension.
Is it 4 degrees of flexion? I don't know. That's what I'm asking you guys.
It'll be-
No, I
Right,
think,
mine's
I think
differently.
with I think it was flipped, so I think.
It was less than straight then, or was it more than?
Positive 4
No,
because
it's
it's
4 degrees
hyperextension.
till.
Then minus 4 if it's slightly negative.
So then it would be negative.
That would be negative.
Deflection, 'cause that's 150 degrees.
So then what happens if we're talking about it being 4 extension?
I think the way we were taught was anything past 0, so hyperextension, that gets you a positive.
Positive before neutral would be negative.
Yes,
Yeah.
exactly.
So is it
Which
is it
it
minus
doesn't.
4
Yeah, if
degrees
it's
Before
of
neutral,
extension?
any hyperextension would be
Okay.
positive.
That's how I do it. So it's minus.
You're right, Michelle, you said it was -1.
Okay, thank you. All right. So I just have to make sure I do my inconsistencies. So if you're talking, because you're talking about extension, you're not talking about flexion. It would be minus 4 because it would take 4 degrees to get to your 0. Correct?
So if 0 was if 0 was full extension,
Yes.
right? If you're 4 degrees, let's say from 0, that's negative 4.
Okay.
Is that what you came up with? That's what I did. If you
Okay.
have 4 of hyper, that's positive 4.
Yes.
Yeah.
So that's
Okay.
4 extra degrees.
Yes.
But then you have to write it out as hyperextension. So he's minus 4 from elbow extension. Okay? And then the other side was 0. You seeing this yet? Oh, this is
No,
gonna
that
be
makes
fun.
sense. Yeah.
Good?
Yeah.
Alright, break up. Let's practice. And then I'll finish it up at the end.